Shalom, shalom, friends. Thank you so much for being here with us today, wherever you are in the world, for us to continue to think about how Jewish wisdom can inspire us to alleviate suffering in the world and bring healing and repair. It's a delight to be here today with Mark Gerson, who is a visionary entrepreneur and founder of the Gerson Lerman Group and 3i members, along with his wife, Rabbi Erica Gerson, founded AMH in 2010, driven by the Torah's mandate to help strangers and uplift communities. Together, they've dedicated their lives to ensuring equitable access to medical care across Africa through Christian-provided healthcare services. Their work resonates with the powerful belief that saving one life is akin to saving the world. Thank you both so much for being here.
Thank you. It's great to be here.
Thank you.
So, Rabbi Erica, to start with you, what motivated you to become involved in global health philanthropy, and why did you choose African Mission Healthcare as the platform for this work?
Yeah, thanks again for having us. And I think we feel really aligned with your passion and to take Torah out of just the classroom, but really bring it into the world and heed the call, not just in our heads and in our conversations, but in our deeds. So it's really great to be with you today. Mark can speak a little bit more about exactly how we got involved, but the basic thing that happens is relationships so often bring us to our first cause. And so one piece of this that Mark can tell is the story of how he got to know his college friend, Dr. John Fielder, who brought us to this. Mark, do you want to start with that? And then maybe we'll talk about why we're so involved.
Yeah, sure. So it was about year 2001 or so, and my dear friend from college, we graduated in 94, John Fielder, he had graduated from the Johns Hopkins Medical Residency Program, and he called me and he said, as you know, I'm a Christian. And I said, yes. And he said, well, I feel called to go serve those who the book of Matthew calls the least among us. And he said, in this case, Africans are being ravaged by HIV, and I feel called to go serve them. So he went over to Africa, in that case, initially Kenya, and he's back in Kenya now, as a doctor serving patients with HIV and AIDS. And this was at a time when HIV was really ravaging the whole continent of Africa. And John was fighting against death on behalf of life with the little resources he had at the time. And in the course of his service as a medical missionary, and he's a lifelong medical missionary, he's of course still a Christian medical missionary, he identified, this is in the early 2000s, that the biggest humanitarian problem in the world is the lack of access to any kind of healthcare for almost everybody in Africa. So he said, it's not only HIV. He said, if your daughter falls and breaks her arm, she's likely to get no treatment. If a man is working in the fields and develops a hernia, he's likely to suffer forever. If a woman needs a cesarean section, she's unlikely to be able to get it. If she develops a birth injury, that'll be with her for life. All these things are fixable. Many of them don't even get discussed in the West because they just get solved before they become an issue of discussion. But in Africa, they're lifelong sentences, sometimes death sentences. So he said the only people who are providing consistent and ever-improving access to medical care for the African poor are Christian missionary physicians serving at Christian hospitals. So we decided in 2010 to co-found African Mission Healthcare, which would partner with Christian doctors at Christian mission hospitals throughout Africa to provide clinical care for the poor, to build infrastructure that might be oxygen, it might be housing, to do hospital administration, and to do lots of training so that the next generation of Africans has lots more people who are trained and equipped to help them with whatever medical needs or conditions they have that are there now. And so we started that in 2010, and that's what African Mission Healthcare has done from then till now.
Awesome, thanks, Mark. Rabbi Erica, and you want to circle back to that other part?
Well, I think the question that is usually on most people's minds is like, well, it sounds very nice, but you're Jewish and you're even a rabbi. Like, of all the things in the world, why are you funding Christian missionaries? This is a little odd. So to give a little more of an explanation, as Mark alluded to, what we came to learn is that a third, if not significantly more, of the quality healthcare in Africa is delivered by Christian doctors. They would call themselves missionary doctors and the churches that were established by the mainline groups in America and other countries. That support has fallen away as the mainline groups in Christianity are shrinking and their budgets for overseas work is shrinking. But basically what we learned is that the only people that can really sustain themselves and do this almost impossible work, right? Pushing a boulder up a mountain every single day with basically like a hurricane coming down at you as you push this boulder up a mountain, you can only sustain that kind of commitment with faith. And so that resonates for us, that it's through their faith. The doctors aren't there because they're motivated to go convert another person to Christianity, which, by the way, if they do, good for them. That's, God bless them and may they live a life of faith. But that's not what it really means for them to be a missionary doctor. It's really about, as Dr. John Fielder would say, he feels called by his faith to serve and love as Jesus would. And if Jesus would go and help the poor and the most needy, then that is what God would want him to do. And that feels very much aligned with what we understand in our faith, that God wants us to be like God, to partner with God, to emulate God as healers, as people who don't just pray for miracles, but who get out and do the work. So it feels very aligned with our Judaism. And then on top of that, we talk a lot about loving the stranger. And as I'm sure you know, it's the commandments in variety of forms, more than anything else, is how we treat the stranger. And Mark always says it so well, that why are there so many commandments about the stranger and not to love your children? Because loving your children comes easily, but loving the stranger, caring about that child or that mother who doesn't look like you, doesn't live like you, you're never going to see them and you're never going to have to feel their pain. That takes work. And so God has to remind us again and again that their suffering is no different than the suffering of, let's say, the person who you see on the GoFundMe for an American surgery, that generous Americans will gladly give $300,000 for one baby that needs it here, but finding that same heart for Africa can be harder. So we try to challenge ourselves to live up to God's expectations on that.
Beautiful. I love that so much. Can you share a little bit about your vision for African mission healthcare and kind of its role in reducing global health disparities?
Sure.
Mark, let's start with you, Mark. Thanks. Yeah,
of course. Our ultimate goal, which we will not achieve in our lifetimes, is that everyone in Africa will have access to quality healthcare. And I think it's important that everyone establish a goal they won't achieve in their lifetimes. Just like the Torah ends with Moses not arriving in the promised land, we should establish a goal that will survive us. But we're making progress towards that goal really all the time. So that's our ultimate goal. And then the question is, well, how do we achieve it? And we achieve it by building the Christian medical mission sector. So we partner with 31 different hospitals across 17 different countries all throughout East and Central Africa. And we work very closely with each hospital to establish their current capabilities, their near-term and longer-term capabilities, to develop plans to help them achieve them, and then to fund what needs to be built in order to achieve them, and to work very closely with them on everything from sometimes architecture to electricity to medical provisioning, to hospital administration, whatever it is, given the specific circumstance, to help that hospital, which very often will serve, it could be one hospital, but it'll very often serve, 1 million to 3 or 4 million people, to continue doing what they're doing well, get better at it, and to build new capabilities so that the residents in their catchment area will have access to the kinds of care that we all have here in the U.S.
Very cool. Rabbi, how do you kind of think about kind of the Jewish mandate and moral mandate? For some of us who live with so much, to talk about a value of sacrifice in order to, leverage some of that fund, leverage some of those funds towards alleviating suffering, where it's sometimes not so expensive to get some of the basic things that people need. How do you talk about that virtue of sacrifice, and how do you find that lands?
It's a great question. We talk and we think a lot about how we give, on a lot of different dimensions. One of the basic things that we think about is return on investment, which is a really, ROI. It's a very common terminology for people in the business world, but we don't often invoke it when we're talking about tzedakah. And we think that we have a moral obligation, we meaning all of us, to be really serious in our philanthropy and our tzedakah giving, that it's not just, oh, well, my brother-in-law asked, or this bat mitzvah child picked this thing. We think that whatever resources God has blessed you with, you have a real moral obligation to dispense in the best possible return on investment way that you can. So thinking really rigorously about what you do with each and every dollar. So we take that really seriously. As you said, for the African healthcare, it's incredible when you think about what it costs to save a life. You can literally calculate it, right? If you can do a C-section for a few $100s, that's not only a life save for the baby, it's a life save for the mother and a family that doesn't have an orphan family. If you can do a repair on a broken leg, you can expect that person will go on to have a full, healthy life after that, and they'll be able to go back to work and provide for their family and all these things. So we try to always model that out. On the other side of it, when you think about what does it mean as a giver to really give, it's always a challenge, and I understand that people want to feel good and want to feel involved. And like, again, I was talking about kids and their B'nai Mitzvah projects. Everyone says, well, I don't want to just write a check. And it's like, okay, well, but writing the check is sometimes the most important thing. So our friend said they get, not from the Jewish world, but from the Christian world, they get junk for Jesus. So people are like, oh, I'll give you all my old stuff. Like, that's like the lowest level, right? If Maimonides had more than 8 levels, maybe that would be like the bottom one, is giving your junk away to other people.
Yes, exactly.
But what really we're called upon is to think about in what way can we have the biggest impact? So like, there are some cases where if you're a doctor in America, there are sometimes an instance where it can be really helpful to go over. If you can help the local doctors for a week or 2 or 3 weeks, and you can train them on a new technique, which sometimes happens, or you can do something that they just can't do. So whether it's like glaucoma surgery or something like that, that can be helpful. There are pros and cons, but there are some cases where being a doctor or a medical professional and going over can be very helpful. What's usually more helpful, and what we've tried to encourage people to do, not yet successfully, but maybe you'll help, is think about, if you would like to go and give a week or 2 weeks or a month of service, what would it look like to just dedicate that time and say, okay, I'd like to go do that, but I actually don't have the skill set that's needed. So I'm in real estate. I can volunteer my week and say, this week of money that I'm making, I am earmarking in sort of sacrificial giving to put into tzedakah. So it brings that meaning to your work, but the reality is that it's not effective for every person to buy a ticket and fly over to Kenya and go bother them for a week when you don't know what's going on and you don't know the norms, you don't have the skills. So,
Right.
Step 1 is having the heart for it, and step 2 is really using your brain to think, what's the most effective way that I can make a difference.
Yeah, so well said, Mark. So I spent some time in some villages in Ghana and Senegal and South Africa, and as you mentioned earlier, as you both mentioned, the needs are just enormous, through the roof, things we can't imagine. I mean, if you don't even have access to clean water to drink, or the girls don't have basic, hygiene products, so they can't go, they miss a lot of school. There's no safe sex education, not to mention even access to, supplies, or medication or hospitals. And so I saw people dancing around rocks, and doing things to try to find healing, And so where do you begin? Like, when the needs are just enormous, where do you even begin to address the problem?
Healthcare. I mean, so we think healthcare is the fundamental thing, because if you're let's say you're a student and you break your leg playing, like all of our collective kids have at some point, right? And okay, so you have one experience if you go and you get it casted and you're back in school the next day. You have a very different life experience if your leg is up in traction for 12 weeks. If you're
lucky, you get that.
Yeah, exactly. I mean, if you're a mother and you need a C-section, and Erica had 4, if you need a C-section and you can get it, okay, you're home 3 days later with a healthy baby, God willing. If you can't get it, you might be dead, or you might be so disabled that you're through a birth injury that you're fundamentally incapable of caring for your other children and participating in the community. So healthcare, we think, is the foundation of everything. And therefore, we think that the highest ROI, as Erica said, the highest return on investment comes through healthcare, and even more so with healthcare done well through the Christian sector, because they are extraordinarily effective and maniacally efficient. I mean, I've never seen in business or nonprofits the kinds of economic tracking that we see in African mission healthcare. And we know exactly how much it costs to help a woman in Uganda and a woman in Kenya and a woman in Burundi have a C-section. And we know exactly what she's going to be able to do after that she wouldn't be able to do beforehand. And we're able to dial that down even further to say, how much does it cost to provide a healthy year to a person? And in some places, it's well under $100. So for well over $100, you can say, I'm going to buy a healthy year for somebody in the Nuba Mountains, in Kenya, in Malawi, in lots of places we work. And the ROI on spending less than $100 to provide somebody with a healthy year of life, and of course, we anticipate in the case of, say, a woman giving birth, 50 or 60 years of healthy life, it's just a spectacular ROI and a great way to fulfill our Jewish commandment to love the stranger.
I want to add, I think, Rabbi, part of what you were alluding to in your question is just that it's so enormous, that the need is so enormous that it sometimes feels insurmountable. We had Dr. Tom Katina in our home. He's an incredible doctor. He grew up here in America in upstate New York, went to Brown, played football there. And he said he can't quite explain it, but as a person of faith, he said some people look for the greener where the grass is greener, and he was just always looking for where it was browner. So he volunteered in Kenya. He said, no, this is a little too cushy for me. Where is there even more desperate than this? Well, he found himself up in the Nuba Mountains in between North and South Sudan, where he's a doctor to over a million. What do you know what the number is, Mark? Some ridiculous amount of patients.
Yeah, he's a catchment area of about a little over 2 million.
But what he has said that really touched my heart, he said, people say, Dr. Tom, like, how do you do this work? It's just, even if you can do amazing stuff and amazing surgery, he said, it's a drop in the ocean. There's so much need in Africa. And he said, well, when I'm with a patient, I don't see a drop. I see a human being, and
Right.
That is a world. And that just brings to life for me our own teaching, right? That if you save one life, you saved an entire world. And he sees that by the day. So can we help everyone? No. Can we solve every problem? No. But there really is, we have in our materials this curve of healthcare and what the return can be on the dollar. So the very bottom is things like the malaria nets and certain inoculations that can prevent certain diseases. Those are maybe pennies, although not really, because there has to be some infrastructure that's funded to do that. But we're at just the next spot on that curve, which is still extremely high, where, if you think about what our friends, what do they spend sending flowers to someone in the hospital who's had a C-section? She doesn't need flowers, but
Right.
and if you and your friends get together, you can actually provide a C-section for about $300 for a woman in Africa. Like, if we really stopped and thought about it, that's what we would do. We would say, right, I want to honor your new baby, not with another jumper or a cute cashmere blanket or a silver rattle, but with funding someone else to get the same healthcare that you deserved and benefited from. And I think that's the kind of difference that we can make. And it's really not too far off. I always go back to the line from Deuteronomy, right? It's not in the heavens. It's not so far off. It's not so complicated. And I think Africa in particular, people feel like, I don't know, it's Africa. And I hear a lot of stories. Where's the money really going to go? And there's a lot of corruption. Is it going to get there? And what we're trying to do with African Mission Healthcare is say there is an address you can go to, you can trust, and you can know that if you put this money in, you are going to change a life. And so we haven't gotten to our final goal yet, but I think we've gotten to that goal where we know that we can steward your money and get it from a place in America into the hands of a healthcare worker in Africa. And I was there this summer with my son. We've seen the outcomes, and we really can save lives for a few $100s.
Yeah.
Right. The Torah teaches us, you shall not stand by the blood of your neighbor. It doesn't say you shall not stand by the blood of your neighbor unless there are lots of other problems. I mean, if we could just make this very personal for everybody. I mean, if someone was in a car accident and their daughter was seriously injured, how would we feel, or even how would we think if a motorist just passed by and did nothing and then explained, well, look, there are lots of problems in the world. Yeah, I know your daughter got mangled in a car accident, but there are lots of problems in the world. We would think that person is deeply cruel, and we would be right. So what's the difference between someone listening here's daughter and someone's daughter in the Nuba Mountains who may have been in an accident or may need a C-section. There's really no difference. And it's incumbent upon each of us, pursuant to the Torah commandment, not to stand by the blood of our neighbor. So if we know that, to use Erica's example, we can help a woman who otherwise wouldn't be able to get a C-section for under $300, we're really not allowed by the lights of the Torah to say, well, there are so many problems. We're required by the lights of the Torah to say, well, I'm going to help.
Yeah, it may have been in the centuries back that we could have said our neighbor is only physical proximity.
Exactly.
But today, in a global interconnected world where we see and we can fly easily and we know what's happening, our neighbor has shrunk in terms of who they are.
Yeah, I mean, and to that point, I mean, you don't have to fly. You could just go online and go to, anyone can type in just WATSI African Mission Healthcare, and you can see our cases, our surgical cases on WATSI's site. WATSI's a great partner of ours. And you can see the patient. You can see how much exactly it's going to cost to help him or her. You can see what the condition is. You can see what her life is likely to be like if it's resolved. And you're right. It's now, you wouldn't have been able to imagine that several hundred years ago. You wouldn't be able to picture it 25 years ago, but now it's there for anybody with an internet connection.
Yeah, so well said. So speaking in line with the values you're sharing, Rabbi Yisrael Salanter famously taught, the founder of the Musar movement, that my spiritual needs are addressing your physical needs, and that really resonates for me in terms of how I think of Judaism. And yet, Rabbi, to ask you, there are missionaries, of course, who are deeply interested in addressing other people's physical needs, but also have a spiritual agenda as well. And I wonder how you think about that. So it totally makes sense to me as a business model, like work with the best partners. It makes sense to me as an interfaith model that we want to build bridges of interfaith connections. It even makes sense to me if people are motivated by Christian teachings. But I wonder when you see a kind of a proselytizing agenda in the work, like how do you experience that? How do you engage with that?
Yeah. So, like I said, we've been on the ground in several of our partners' settings this summer. My son and I had the honor of going up to the mountains in Kenya and being with our good friends who actually they speak Hebrew. Their kids gave birth in Israel, and their grandkids have like Jewish Torah names. They're amazing Christians who really love the Bible, love the Jewish people, and love Israel. What I see day to day, here are some of the ways that faith plays out in this setting. There are optional Bible study meetings for the staff, and some of them come to them in the morning. They will pray for their patients. They'll pray for themselves to be successful when they do a surgery. If patients ask them to pray, they will do that with them. They will never, ever say to a patient, who are you? What is your religion? Do you accept any of this? There's no talk about what your religion is, what your beliefs are when you come into the hospital for treatment. It just doesn't happen. What does happen sometimes is when a patient is about to entrust their life in your hands, they may turn to the doctor and say, can we pray before we have the surgery? But it is rare, very rare that they get into conversations of faith. There's just so much else going on. They're really just trying to get through the day and deliver the healthcare. To the extent, like I said, that someone goes from, in the communities where they operate, there's some sort of like local folk animistic stuff in there a little bit. If that person finds a God that is, similar, a transcendent God, I think that's a wonderful thing. If they find the values that are presented in Christianity and much the same as in Judaism, I think that's a wonderful thing. So it gives me no pause at all. I had no interest in converting that person to Judaism. That's not, as you know, what we do unless they came and wanted to. So, I wish everyone well, and it doesn't, that's kind of just the extent of it. Mark, do you want to add anything? We lost your sound, Mark. You're on mute.
So I think that's very well put. And I remember being in Tanzania, I think it was 2016. And I was with a great missionary physician for 2 days. And I said to him at the end of 2 days, I said, I didn't see you like talk about Christianity with anybody. And he said, you can't really do that until what? He said, you can't have the conversation productively until someone says, why do you care so much? He said, until someone says that, the door is not open. I said, so how often does that happen? He said, well, not that often, because as Erica said, everyone, I mean, I remember another time in Kenya just seeing, I took just 2 minutes to meet the missionary surgeon there because there were about 10 hours of patients waiting to see him. But what he was saying is that the missionary, as conventionally defined message, is only accessible when the person says, "Why do you care so much?" So that's the prelude to it. But no, as Erica said, we're very enthusiastic to be supportive of these Christian missionary physicians in all they do, and when you see a lot of the places that they work in, not all of them, but it's a lot of what they're dealing with. I remember being in one place in Africa, and there was a nursing school, and they didn't send the nurses home until the nurses were like 18 or 19 or something. And I said, why? And they said, because if you send a teenage girl home, she's likely to be sold into someone's harem. So I'm like, please convert them to Christianity. Because that would never happen in a Christian culture, of course. And so, but they, that's really not their, as Erica said, their missionary role is not that. It's, I mean, if that happens, great, but it's really about answering the call of their faith, and acting as Jesus would, and bringing care to what the book of Matthew calls the least among us. But
Yeah.
no, we're very comfortable working with, not only comfortable, enthusiastic about working with missionaries in all they do, and really with all they are.
Very nice. Rabbi, last question. People who want to get involved, people who want to support, how can they do that?
Thank you for the question. I should know the answer. The website is africanmissionhealthcare.org. So that's a great place to learn more about our work. There's also the great partner WATSI, WATSI, and that is a place where you can participate in the crowdfunding of surgeries for even the kinds of money that your kids could raise at a bake sale, or hopefully more than that. But it's a great place to do it as well. And start there. And if you want to get more involved, email is on the website, and we would love to hear from you.
Beautiful. Thank you both so much for what you do. It's very inspiring. And we wish you a Shana Tova, a year of good health for you and your family, but also for all people created in the image of God, that they should experience their own dignity through the opportunity to have accessible healthcare.
Thank you so much.
Thank you so much.